Well, that was fascinating. They could not, I don't think they could organise action if it came with instructions, but let's talk about the faith that Queenslanders have in the public health system, because it has dissipated under Labor's decade in office. We've had record ambulance ramping. We've had record number of Queenslanders waiting for elective surgery, over 60,000 of them. We've had over 280,000 Queenslanders waiting to see specialists. Too many Queenslander families and vulnerable people are waiting too long to receive the health services they need, and too many healthcare workers are stretched beyond their limits. Our population is growing and ageing, and our health system must keep up. Last week, we actually did speak up very, very proudly. And we shared the great news that our government is making the biggest investment in health infrastructure Queensland has ever seen, and Far North Queensland is front and centre. After years of delays, broken promises and total inefficiency from the former government, Cairns is finally going to get the hospital upgrades that we deserve. This isn't just construction, it's real outcomes for local patients, families and health workers. And our hospital rescue plan will build new hospital beds and upgrade and expand existing ones to deliver 2,600 beds for our communities across Queensland, and alongside more investment in a bigger health workforce. This is the largest investment in hospital infrastructure. I'll take that interjection from you, Member for Cairns. We are going to have 64 new overnight beds by 2027. The Cairns Adolescent Acute Mental Health Project will also invest in 8 new beds, because you forgot those in your mental health ward. And these will be critical to help with mental health issues with our youth. And there'll be a new plan and a design for well, it wasn't going to happen under your watch. There will be a new plan and a design for the surgical centre, developed in collaboration with the hospital, because they weren't collaborated with. And it is really important that they are consulted so that we deliver the best results, because they were saying that it was so discombobulated that there was one wing over here and one wing over there, and it was going to be totally inefficient. So there'll be at least 40 new overnight beds in the surgical centre. And we're also going to collaborate with local tertiary education providers for a future health and innovation precinct, faster than you will. Last but not least, we will be investing in a new multi-storey car park, because car parking is important. I know you forgot it in Wangeti Trail, and I know you forgot it with your plan for the hospital, but we will not forget parking, because parking is really important, and it is essential for stressed people that are already in a stressed state at a hospital that need to find a park as well. And it's something that is even more mind-blowing than that, is the fact that there has not been a new and safe location for the Cairns Hospital helipad, which is not operating to safe standards. And the fact that the former government did not address one of the highest clinical and public safety risks for Cairns, which is the reconstruction of the new helipad away from the Esplanade site, is an accident waiting to happen. The Cairns Hospital under the former government was on track for a $378 million cost blowout. So this was the Labor, I'll call it the no plan. So there was no plan to deliver the surgical centre. There was no plan for funding or a site for a car park. There was no plan to stick to costs. There was no plan for a helipad relocation.
You've had your turn, Member for Cairns.
There was no plan to consult with the health and hospital service on the surgical centre. There was no plan to reduce hospital wait lists. There was no plan to reduce ambulance ramping. There was no plan to reduce elective surgery wait lists, and there was no plan to deliver what Far North Queensland needs. Our plan is clear, and we will deliver easier access to health services for Queenslanders across our state. We will deliver the largest investment in hospital infrastructure the Queensland has ever seen. And we will deliver 64 new overnight beds. We will deliver 8 new adolescent beds in the acute mental health precinct. We will deliver at least 40 new overnight beds at the surgical centre, and we will deliver a surgical centre in consultation with the experts on the ground. And we will deliver a new multi-storey car park. Right across Queensland, we're committed to delivering easier access to health services, and after years of delays and broken promises under Labor, Cairns will finally get the hospital upgrades we deserve. And this isn't just construction, it's real outcomes for local patients, families and our health workers. Thank you.
Mr. Speaker.
I call the member for Greenslopes.
Gee, I haven't heard someone saying I'm going to do so much since I listened to the Greens speaking down the polling booth. I'm going to do this, I'm going to do that, I'm going